And we're back. So we're just going to discuss, now that we did our video, we're just going to discuss some of our cases and our research and how it affected how we feel about the entire situation. So I'm going to go over the cause and effects of how one dose 50 pills occurred. So we identified people, environment, equipment, process, management, and materials to all contribute to the effect, which was medication error, because the intern ordered prednisone 20 milligram tabs 50 now, all in the one dose. So for people, the new intern, which I played in the video, who's extremely inexperienced and didn't like being questioned by the pharmacist and the nurse. So the whole care collaboration was wrong. So the senior citizen patient was also in the video. The pharmacist was in disagreement with the intern's order, so that was a cause as well. And then the angered patient. So for the environmental issues that we identified, so it was a teaching hospital, and we've all done nursing rotations at teaching hospitals and see the residents team, everyone's walking. So it is a much fast-paced, high-energy environment, and mistakes do happen. So there is a lot of pressure as well with these new residents coming out on the floor. Maybe they weren't trained properly, and maybe they have too much leeway. Sometimes there's miscommunication between the healthcare providers and then the non-respectful coexistence in terms of opinions from non-physician professionals. So in the video, I was almost annoyed that a physician could question like my decision, and I was annoyed that the nurse questioned my decision, when in fact it was the right thing to do and I made a mistake. But I'm sure we've all seen some doctors act like that on the floors. So for equipment, there's an online medical record as well as written orders, which is now going to be a whole new thing when we get out into the nursing field, because most things will now all be electronically, so hopefully that'll help streamline and catch some errors. The other equipment was involved is the prednisone 50 20 milligram tabs and the intravenous prednisone, which should have been given in the first place. So for the process, the patient was put under the care of a teaching team. Teaching team is like a senior doctor who is teaching a group of residents. So the whole team takes care of each patient. It's not like the patient has a specific provider. So that is an issue where this was not picked up, because no one checked my order and I just kept going with my day. And I was a new intern and I misunderstood. I completely misunderstood the order and I totally should have changed it. And there is a lack of communication amongst healthcare teams, and I feel like nurses need to stick up sometimes and like make sure, like thank God Erin stops the patient from taking the 50 pills and like notice that this was an error, and I think that's something we're all going to incorporate in our nursing career. So for management, it was a chain of command: the senior resident, the pharmacist, then the nurse. And as the resident, I was offended to be questioned. And it's a teaching and training thing. There's really not much mandatory teaching between a new intern. Like, you kind of just get out, get your license, and then you can prescribe to patients, and maybe you're not really as well educated as a physician who's been there for 50 years kind of thing. And it was inexperienced and not compromising, and those were all the issues in the management of this patient that contributed to the effect. And so for the materials we flagged, it was like a written order, then a verbal order, and then the medication record with the documentation of the med order. So basically, there's a lot of things that went into this, and that is what caused this error.
So there are a lot of things we thought could be done to prevent this in the future, because although the patient wasn't badly harmed, another medication taken 50 times could really kill someone. So patient safety programs are great. They should be in all hospitals, whether they're federally funded or private. And they should be aligned with the Joint Commission and what they have to say, because there's a Speak Up program for effective communication, and they're proven to save lives. The communication, as we said, should be much better within the medical team as well, interdisciplinary, the nurse, the pharmacist, the whole care team. Everything should be checked and double checked. There's flow charts and flow sheets of care that can be implemented. It keeps things organized. It makes sure that everything is read and seen by a couple of different eyes, as well as patient advocacy. And that really comes in the greatest with nursing, because we're the ones who are giving the pills. Like, we need to stand up for our patients and and if we know a situation isn't right, that's when we should step up. Barriers?
So I'm going to talk about the barriers, and one of the biggest barriers was miscommunication. A lot of times that happens because one healthcare provider doesn't want to be wrong versus the other. So I think that's something that healthcare providers need to work on and understand that sometimes a second suggestion or opinion should be incorporated into caring for a patient and keeping the patient safety. Also, time management. Sometimes when you're in a high stress, fast environment, sometimes people tend to do things quickly without double checking. And I think the miscommunications that, like Holly said before with the resident, how he didn't have enough experience, so he just went off whatever he was reading instead of just double checking. And also, just in terms of education as nurses, the double checking should have also been on the nurse. Like, she should have double checked before she gave the medication.
Yeah, so I'm just kind of reiterate everything. So as nursing students, our biggest takeaway is the responsibility of the nurse, and the nurse is the last one to check the order before it's actually administered to the patient. So despite if the order is written right or wrong, it's on the nurse to recognize that and not give the med if it's an error. And so I think that what we took away from it is it's something we'll never do in our careers, because you can see how badly it can affect a patient. Luckily this wasn't the case in this situation, but
Yeah. Ready to be real nurses.